House Appropriations Subcommittee on Medicaid and Behavioral Health will come to order. Clerk, will you please take the roll?
Chair Van Workum.
Here.
Vice Chair Green.
Present.
Representative Roth.
Here.
Representative Kuhn. Representative Robinson. Vice Chair Rogers.
Here.
Representative Glanville.
Present.
Mr. Chair, you have a quorum.
Thank you, Mr. Clerk. Representative Glanville moves to approve the minutes of the March 18th meeting. There being no objections, the minutes are approved. Today we got two presentations before committee. The first will be a presentation from the Office of Inspector General. We look forward to hearing what the Inspector General's office has been doing, particularly on finding fraud and abuse in the system. We have with us Stacy Sampson, Senior Deputy Director, as well as Douglas Woodward, the Director of Bureau of Public Assistance Fraud. Thank you for joining the committee, and the floor is yours.
Thank you. Good morning. I'm Stacy Sampson. I'm the Inspector General for Health and Human Services. Thank you for inviting me here today. It's my pleasure to provide an overview of the Office of Inspector General for Health and Human Services today. I'll start with a little history of how our office came to be. We are actually a combination of two former OIGs. The Human Services OIG was created in 1972 as a criminal justice agency by the Social Welfare Act. And the Health Services OIG was created by executive order as an independent and autonomous entity within the former Department of Community Health. In 2015, the two OIGs were merged into one. Our mission is to assist the department in maintaining integrity and accountability in the administration of its health and human services programs, and to ensure appropriate and efficient use of public resources. In addition to investigating cases of alleged fraud, waste, and abuse in the programs administered by the department, we also make referrals for prosecution, review administrative policies, procedures, and practices, and make recommendations to improve program integrity and accountability. The two largest programs are Medicaid and the food assistance programs, and these are the two programs that I'll focus on today. These programs are vital because they provide essential resources and support for individuals and communities addressing social determinants of health, promoting well-being, and ensuring access to health care, social services, and other crucial needs. Last year, Medicaid had approximately 4 million beneficiaries, 237,000 providers, and a budget of almost $24 billion. There were also almost 90 million Medicaid transactions. The food assistance program had almost 2 million enrolled recipients, over 10,000 retailers, and a budget of $3.2 billion. There were almost 113 food assistance program transactions. We accept allegations of potential fraud, waste, and abuse through email, a website, and a toll-free hotline. We also have a Medicaid fraud flyer that explains why it's important to report fraud, what fraud looks like in the Medicaid program, and how beneficiaries can help to prevent fraud and how to report fraud, Medicaid fraud. We've provided a copy of this flyer to this committee. We include this flyer in all mailings that we send to both providers and beneficiaries. The landscape of public benefits fraud is a dynamic and ever-changing environment. Our staff consistently develop innovative and creative ways to identify, prevent, and combat fraud, waste, and abuse. We utilize a multitude of complex analysis, predictive analytics, and data mining solutions to uncover potential fraud. More than half of our investigations come from data analytics. Our investigators use analytics information to focus their efforts to areas with the greatest risk and return, leading to recoveries and discouraging future abuse. Over the years, we've developed data sharing agreements with several other state agencies to allow us to use their data to identify potential fraud within our programs. I've listed 6 examples of data scenarios that we use regularly. Unfortunately, we can't publish too many details about our data analytics tools because fraudsters would change their behaviors to avoid detection. OIG is a member of an interagency fraud group that brings together 8 state agencies with authority to identify fraud in state government. By meeting quarterly, this group has improved communication and coordination between the various fraud oversight agencies within the state. Each program has its own set of eligibility rules, which are usually asset and/or income-based. Our investigators determine whether a recipient was truthful in their application. Last year, we performed almost 17,000 public assistance application investigations, resulting in $81 million in cost avoidance. The Public Assistance Reporting Information System, or PARIS, is a data matching service supplied by the U.S. government, matching recipients of public assistance to check if they receive duplicate benefits in more than 2 states, or in 2 states or more. We investigate PARIS matches to help identify improper payments and minimize fraud and abuse. For example, a PARIS investigation revealed that a recipient did not properly report receiving food assistance benefits in both Michigan and Arizona. The recipient maintained a residence and employment outside of Michigan, exclusively utilizing their Michigan benefits in Arizona for over 6 months. The recipient was ordered to pay over $7,000 in restitution and received a 10-year program disqualification. Last fiscal year, investigated PARIS matches resulted in almost $20 million in cost avoidance for Michigan. Through our front-end eligibility program, we partner with a local office staff when an application has discrepancies and/or appear suspicious. The local office staff refer suspicious applications to OIG, and our investigators confirm the accuracy of the income, asset, household composition information disclosed by the applicant. Of the 17,000 application investigations that we performed last fiscal year, over 8,000 were front-end eligibility investigations, resulting in over 4,000 of these suspicious applications to be denied, reduced, or withdrawn. As a result, we saved the department almost $32 million in public assistance benefits that may have otherwise been approved. Criminals fraudulently acquire stolen identities to obtain public assistance program benefits. For example, one individual used stolen identities to submit over 200 fraudulent applications and steal $33,000 in food stamp benefits. Another individual used the identity of stolen identities, including 2 deceased persons, to steal nearly $75,000 in food assistance benefits. This photo was taken during one of our investigations. Notice the fraudster included a sticker with the relevant PIN number on each of the bridge cards to help keep them straight. Individuals sometimes sell or trade their benefits for cash or other items. They might sell the value of their bridge card to family and friends or advertise their benefit for sale on social media. While investigating unusual bridge card transactions, we discovered that the owner of a catering business purchased over $80,000 in food assistance benefits at a reduced rate to supply food for his business. The caterer was criminally charged, and that case is currently pending in court. This photo shows 2 individuals who purchased over $1,200 in worth of bulk cooking oil for resale using a bridge card. In total, 625 units of oil weighing 35 pounds each and totaling $20,000 were purchased with bridge cards from Illinois, California, and Michigan. Over the past few years, bridge card cloning fraud has affected thousands of Michigan bridge card holders. These thieves place a skimmer on top of the store's credit card reader to copy the bridge card information and PIN. They transfer the data to an unauthorized card and use it to steal the card holder's bridge card balance. This photo is a skimmer attached to a card reader at a store. This past year, we developed algorithms and data tools for early detection of compromised accounts and skimmer locations. Our EBT skimmer analysis uses geolocation data and recipient shopping patterns to identify potential placement of skimmers at retail stores. We partner with the USDA OIG when we identify these skimmers. These analytics activities have resulted in the detection and confiscation of 44 skimmers at Michigan retailers, have safeguarded over 76,000 individual bridge card accounts and more than $16 million in food stamp funds. Last fiscal year, we performed over 1,000 Medicaid provider investigations, resulting in almost $190 million in overpayment receivables and cost avoidance. For example, a medical clinic signed a $1 million settlement agreement with the AG's office, including almost $450,000 in restitution to Medicaid. The clinic billed for evaluation and management services during drive-through COVID testing, when those additional services were not performed. In addition, a pharmacy signed a $650,000 settlement with the AG's office, including $400,000 in restitution to Medicaid. In this case, the pharmacy fraudulently bills for drugs that they did not dispense. Medicaid beneficiaries may utilize their Medicaid benefit in a fraudulent way. They might use their Medicaid benefit to obtain prescriptions that they then sell to others. They might accept a kickback from a provider in exchange for allowing the provider to use their Medicaid number to bill fraudulently. They might falsely claim that they require services that they do not in order to obtain payment from Medicaid for themselves and/or for friends and family. For example, an investigation revealed that a beneficiary received Medicaid long-term care benefits after their relative failed to properly disclose assets to determine their eligibility. By failing to report the assets, $43,000 in Medicaid benefits were fraudulently obtained. The relative pled guilty to welfare fraud and was ordered to pay restitution. The results of these investigations are presented to state and county prosecutors for consideration for prosecution. This list represents the relevant fraud statutes that may be 200 felony warrants were authorized by county, state, and federal prosecutors. Last year, we developed a welfare pretrial diversion program with the AG's office. Enrollment of a defendant in the diversion program, as opposed to traditional criminal prosecution, is determined by prosecutors on a case-by-case basis. This diversion program resolves cases of fraud and public assistance programs before necessitating criminal charges, prosecution, and potentially lengthy trials within the court system. This program increases accountability in public assistance programs while ensuring justice is administered efficiently. Since its inception, there have been 46 participants in the diversion program, and $74,000 has been returned to the state of Michigan. The impressive results I've shared here today are made possible by the innovation and dedication of the employees of OIG. For every dollar spent, OIG had an $11 positive impact on the department's program integrity. If you're interested in reading more about our accomplishments, I've included a link to our annual reports. More than half of our budget comes from federal funds from Medicaid and the food assistance program. We also have an interdepartmental grant with the Michigan Lifelong Education Advancement and Potential, or MyLEAP, and because they pay for the child development care investigations that we perform. When available, we also apply for and obtain federal grants to purchase data analytics software, provide training to our investigators, and promote fraud awareness campaigns to the public. Thank you again for inviting me here today. The actions of OIG benefits all citizens by helping ensure that funds for these programs are available to the Michigan residents that truly need them. Taxpayers' money is spent on its intended purpose, and benefit programs are operating as expected. I am fortunate to lead such a dedicated team, and am proud of our ongoing work to improve integrity in the public assistance programs administered by the department.
Thank you. Thank you very much for your presentation and the work that the OIG does. Representative Green.
Thank you, Mr. Chair, and thank you for being here. This isn't really a question. Over the last several years, and then specifically last several months, obviously on the federal side, we have seen a big push to weed out a lot of exactly what you're doing. So I appreciate what you're doing and the years that you've been doing it on a local level and serving our citizens, making sure the right people get it. So this is not really a question, just a thank you.
Thank you.
All right, Representative Roth?
Thank you, Mr. Chairman. Thank you for your work. The skimmers are always interesting to me, or how, are they finding that these are internal people that work at these facilities that are doing the skimming, or is this a third party that get into the business? Can you give me any information on that?
Sure. Thanks for the question. It's a great question. We have gangs that have come in to our country, primarily from Romania, that have gone through, and a lot of those gangs have gotten together, and they go from state to state. They don't stay any particular time. That's been a large part on the federal level. And the skimmers that we find are not inside jobs. Sometimes they do involve with the local store owner if it's a smaller store. But these are in Walmarts, and they look like legitimate cloning skimmers. You can't tell without pulling, and I always tell my family, pull the skimmer before you charge something at Walmart. Because they do steal PIN numbers, the technology is advanced there, and they generally get the signal over on a phone locally through Bluetooth connection, so they can get the card number and the PIN number very quickly and drain the account.
Wow, okay, thank you.
Representative Glanville?
Thank you. And I was trying to get this number, but can you remind me, what is our overall Medicaid budget? Anybody? Anybody? Do you know that number?
For 2026?
Oh.
Let me find it quick. Which part of Medicaid?
Well, what I'm looking for is just so I'm understanding the numbers. You recovered in the last year, you reported the total you recovered was 306 million? Okay. And your department, so thank you for that. But I'm just wondering what the percentage is, like, of the amount we spend in Medicaid. How much does that represent? Is that 0.01%? Is it
Yes.
50%?
It's not huge, but we are also not the only oversight agency looking at Medicaid. So we also have the feds, US, HHS, OIG includes Medicaid in many of their Medicaid investigations. Our health plans also, the Medicaid health plans, they perform their own program integrity work and identify and recover overpayments. And the healthcare fraud division at the AG's office does the same. So
Okay.
I don't have a number for the entirety of Medicaid through all of the various oversight agencies, but we're able to find what we find with the size of the staff that we have.
Sure, and I'm not suggesting, I'm just trying to understand the numbers and how they balance. So I appreciate that you have been able to identify $306 million and recover that, so thank you for your work. Like I said, I'm just trying to understand how that balances against our total spend for these services, because clearly these are important services, and so I just want to make sure we have a clear picture of that. And people are going to take advantage, right, any opportunity they get. I mean, speaking of the skimmers. So I appreciate the work that you do, but I'm just trying to understand the scope and really how big of an issue is this for the state. Thank you.
Thank you. For those that are curious, we've got a couple numbers. The entire budget for this committee is $28.3 billion. The Medicaid side is $15 billion. So you can write that one down on your hand or something for reference.
I got it.
I got a couple, I guess, some questions here. Particularly, you mentioned some of the food assistant fraud, and you gave some examples of the vegetable oil and things like that. what is this more? And you mentioned, I guess, the skimming machines as a gang in Romania. On the food assistance one, is there something more underlying here, or a trend here that people are going for, or is it just individuals kind of doing it, or is it an organized crime type of scenario that we're doing? What's the end goal with the food assistance fraud?
So yes to everything. It's individuals, there's criminal enterprises involved in food assistance trafficking. The end game is 50 cents on the dollar. If I go into in a transaction and I'm trying to get money from my bridge card and I get $200 a month, I can turn that into $100 very easily. And there are stores out there willing to do it, smaller stores generally, that are willing to do that. The feds, the USDA, OIG, they handle the stores. We handle the recipients, but we team with them so that we get them both. We've seen trafficking patterns over the last 15 years go from blatant stores would sell, would do a $200 transaction, and there'd be all these $200 transactions getting into our system. Well, it didn't take us very long. Just last time you went to the grocery store, you don't get an even dollar amount, right? Not very often. So they get $200 for $100. So they give them $100 in cash, and the federal government would be billed the $200. USDA, saw the oil there. USDA and the federal government decides what can be purchased. So small convenience stores and other businesses, smaller businesses that see that as an opportunity to really drive down their costs. So they will sometimes participate in that, knowing that they can double their money also on the retail side and do it that way. So I don't know if that answers your question, but we have lots of those schemes. A lot of them end up with trafficking in the food assistance programs. So just think 50 cents on the dollar. If you have a local liquor store that says we accept food stamps on the banner, we used to see that, and they've got a few bags of chips and some milk, and generally what they're advertising to the general public is, we traffic here.
Representative Roth.
Yeah, just to follow up a little bit, thank you, Mr. Chair. What I'm hearing from you is this is purposeful fraud. This isn't people accidentally selling their bridge card for $200 or $100, sorry. Are you seeing it, is it majority purposeful fraud?
Absolutely, absolutely purposeful. It's gone out into, it used to be a city issue. It's gone out in the burbs. It's gone out in the northern Michigan. We had an employee that called me a couple of years ago and said, hey, I just watched a traffic transaction up in Gaylord at a local convenience store. The clerk handed the money over and ran up. There was nothing purchased there. So it is definitely purposeful.
I've certainly witnessed that over my 60 years of life. I've seen that also as I grew up in Clare County.
Yep.
So not one of the most prosperous counties in the state. So yeah, just curious if there was some, accidental.
No, my wife is a buyer for a living. She was a buyer, and she loves clipping coupons, saving money any way she can. And I can tell you that I had to tell her that it was coming out to the suburbs because people would wait in the parking lots at Meijer, Kroger, not Costco, but the small grocery stores, Walmart. They'd wait outside and they'd say, hey, can I buy your groceries today and you just give me the money for it? I got to buy my baby diapers or whatever. Some of it's really tugging on the heartstrings. Some of it's, that's the pattern has moved out to the burbs. So you see that now out in suburbia. So I told her, hey, if you get that offer, don't take it. It's, even if it's at a discount. So yeah.
Thank you. Appreciate that.
Representative Rogers.
Thank you, Chair. My question following up in this path and topic is, so thank you for testifying about some of the issues you've uncovered. Do you have any, and if you have to follow up with us, that's totally fine. Do you have any, again, speaking on like numbers and scope and percentages, so like we just mentioned several buckets, so there's retailer fraud, there's organized crime ring fraud, and then there's recipient fraud. Do you have a breakdown of what it looks like, or could you give us a ballpark?
I can't because we don't do the retailers. Generally, those are done by the federal government, USDA, OIG. So I don't have a breakdown, and I don't know of any system that puts those numbers together. We can definitely report on the recipient fraud numbers and give you numbers on how many people we've hit on recipients for trafficking, stolen benefits. With stolen benefits, it's generally there's a couple people involved stealing a lot of benefits. So it's not necessarily a one-on-one, it's one on many.
Yeah, thank you for that. And I'm certainly not trying to justify this or by any means, but I'm just curious, again, in terms of scale, when we're looking at money to recover, I'm guesstimating that the federal piece would be much larger than the 300 million. So it'd be interesting to figure that piece out. I do have a follow-up on a different topic, but you can come back if you. Okay.
Representative Glanville?
Thank you. Kind of keeping on this theme, you mentioned you see this moving out to the suburbs. Have you, and this maybe is not your department, but I'm curious if there's a correlation between this move to the suburbs and correlation to increase in ALICE households, or how that correlates between numbers. Are you familiar with the ALICE measurements?
No, I'm not.
Or is the committee, do you know what I'm talking about?
Asset limited, income constrained.
Yes, that's it.
Lloyd.
That's it. All right. I mean, in my particular suburb, that is 38% of our population. I don't know. And that was, I think, 2 or 3 years ago, I pulled that number. So I'm just wondering, again, if there's a correlation there, and that might help us to understand, where we might step in some ways as well. Thank you.
Representative Rogers?
Thank you. My other question is in a different bucket. So the fraudulent area of prescription drugs and medical, like DME medical equipment, could you talk about the scope in Michigan for that you're seeing in your agency?
Could you be a little bit more specific as far as, are you talking about prescribing medication like narcotics that are unnecessary and stolen on the street, or just in general?
Yes.
So we don't spend too much time on that because there are so many law enforcement agencies, federal and state, that focus on that. The majority of those claims are also through our Medicaid health plans, so we expect them to spend their time. We do have on the beneficiary side where we do benefit monitoring, and if a beneficiary is found to be misusing narcotic prescriptions, we can lock them in to a specific prescriber and pharmacy to ensure that they're not doctor shopping or pharmacy shopping to obtain those medications. We actually have an entire team now focused to reviewing beneficiary utilization fraud.
And then, so that gives me one more follow-up question, sorry, Chair. So if you are suspicious of that, and then the physician, like, how does that process work? Because pharmacies are closing. So if you lock them into one pharmacy and their pharmacy closes, how does that?
They would be locked into another pharmacy.
Okay.
We don't make the decision, the Medicaid program does that.
Okay.
So they have a better understanding of which pharmacies are more likely not to close. Usually it was like a national chain, but we've even seen those close over the last few years. I know Rite Aids across the state have closed, and those patients were transferred to Walgreens. But definitely, they make decisions to make sure that they can receive the legitimate medications that they need.
Thank you. Thank you, Chair.
Thank you. You had mentioned in your presentation some of the analytics that you're using, and some of that being confidential of what you can disclose and prevent them from understanding what you are using. We've obviously seen some more headlines in the waste and fraud stuff from the federal level of the new committee and some of the tools that they are using to discover tendencies and trends and things like that. how often are you using new tools? Are some of those tools that the feds are now using being made available to you? We've got IT up next as a presentation, so I'm wondering if some of those technological changes and you've been able to incorporate some of those, or how often are you reviewing and changing some of the technology and analytics that you are using?
We change them all the time. There's a moving target, like I talked about in trafficking earlier, the 100 to 200. They slowly went down to $99.88 when they found out we were doing. Now they're doing small dollar transactions during the day. So we are constantly moving and looking for the new tools. As we adjust, they adjust. As we find more, they find more. We recently did a look into our system on the age, how old is the oldest recipient in our system. We took that and said, I hope we're not paying people or allegedly paying people that much money. And we took a look in the system at the age of some of our people, and we actually sent out and did some pre-certification work and found out that all 17 people that were on public assistance over the age of 100 were living, breathing adults that were legitimately on assistance. So we followed up with that. We've looked at things like that. We share techniques and trends with other states when we go to national conferences. We learn techniques from them. We teach a lot of our techniques. We have a very robust investigative analytics section. Our section manager is here today, and he runs a team and that are always looking ahead, brainstorming, trying to find the new trends in fraud. And when we do learn something and it's potentially that other people have gotten information from, we definitely go after that and pursue it.
We also look for what other agencies that do similar work to us, the types of fraud tools, fraud software that they use, and we do what we can to obtain same or similar. We recently received a grant from the feds to obtain and purchase and pay for such software. So we're in the process right now of getting that contract going.
Thank you. And then you mentioned restitution, and I see you got this new court or diversion program. Restitution is hard to get the money back. Do you have some statistics on how much of that? I know you put a number, or the Attorney General puts out a number saying, this much. Is there a number of how much actually has been retrieved over the restitution process? Is that an upfront, or is that over 5 years? Is that over 10 years? Maybe give a little bit more insight on the expectations of restitution.
That's actually the beauty of that diversion program, is it requires restitution to be paid in order to avoid criminal prosecution. Whereas over the years past, a case could sit in court for years, and even if they're convicted, odds are we're probably not going to get much of that money back because it's been spent. They don't have assets that we can seize. So we're hoping that the more and more people will be put into that diversion program, and we'll see that restitution go up exponentially.
With our food assistance program, we have people who continue to be on food assistance. We do take 20% of their current benefits to pay back. So we do get better restitution on some of the intentional program violations that we find. So there is some of that going on in the background. So if they stay on food assistance, we obviously don't want them on food assistance their entire lives. So it's better when they find a job and we tell them, hey, it'd be really good if you took this opportunity to go out, get some employment and pay us back, rather than using the system to pay it back.
Well, thank you. Seeing no further questions from the committee, thank you, Directors Sampson and Woodward, for presenting today. We appreciate you lending
again.
some insight on what the Office of Attorney Inspector General is doing. So thank you.
Thank you.
Committee members, next up, we have a presentation on the Comprehensive Child Welfare Information System and the IT department in general for the Department of Health and Human Services. With us, we have Deputy Director Ramaswamy of the Strategic Integration Administration at Department of DHHS. We'll let him prepare quickly. We assume you're very quick with the IT stuff coming from the IT. Hopefully the house system is the same as the DHH system, and the two systems talk to each other, and all these things we learn about IT. The floor is yours when you're ready.
Good morning, Committee Chair and members of the committee. Thanks for the opportunity to present in front of you today. My name is Sudhakar Ramaswamy, Senior Deputy Director over Strategic Integration Administration. And I also have Kelly Sesti from Children's Services Administration to help with questions, if questions come up regarding the CVIS update later on. There are two parts to my presentation today. The first will be a quick overview of information technology at the department, and the second part will be an update on the Children's Welfare Information System Modernization Project. So what do we do at Strategic Integration Administration? Oops. There are three primary responsibilities for my administration. First, we ensure all IT investments are aligned with the department's strategic goals. Second, we act as a liaison between our business program areas and our technology partner, DTMB, Department of Technology Management and Budget. This role is very important in making sure the business needs are understood well and the appropriate solutions are designed to meet the business goals. The actual implementation work, project management, and IT vendor contract management, those things belong in DTMB, and DTMB is primarily responsible for the delivery of IT projects. Third, Strategic Integration Administration is also responsible for IT privacy, security compliance, and enterprise data governance. The Chief Compliance Officer and the Chief Data Steward for the department reside in this area. Earlier, I mentioned we ensure that IT investments are aligned with the department's strategic goals. This is done via the IT executive governance process that we facilitate. In 2020, in response to the DTMB Policy 1352, we established an IT executive governance body to manage all IT investments effectively. The governance body is responsible for setting the IT vision and strategy for the department. It's ultimately accountable for all the IT investment portfolio of the department. An important aspect of this process is that all IT work, irrespective of size, complexity, is governed by this process. The IT governance body also provides oversight in terms of changes, modifications to all of the existing systems at the department. Here's the makeup of the governance body. There's 4 members, 3 from the department and 1 from DTMB. In total, there are 289 systems at the department supporting our programs and the residents. But today, I'd like to walk you through 5 primary systems. Bridges Integrated Eligibility Determination System, MyBridges Online Self-Service System, CHAMPS Community Health Automated Medicaid Processing System, MyCEAS, the Michigan Child Support Enforcement System, and MySACWIS, Child Welfare Case Management and Information System. First up is Bridges. Bridges Integrated Eligibility Determination System. Bridges is a multi-benefit integrated eligibility determination system. Bridges provides cash and food assistance, healthcare coverage, and state emergency relief to 2.8 million recipients. There's approximately 1.2 million active cases in the system today. In terms of user base, there are approximately 3,200 application users that range from case specialists to help desk staff and so on. Next is MyBridges. MyBridges is an award-winning online self-service eligibility system for the state of Michigan. It has won multiple awards till date around the theme of best digital engagement with customers in state government. MyBridges allows approximately 3.2 million recipients to manage their account online and perform tasks such as apply for assistance, check for eligibility status, and they're also able to explore community resources via the website. MyBridges has approximately 140,000 application users, including community partners, mandatory reporters, state navigators, and so on. With 3.2 million registered users, this is the second biggest online self-service system in the state of Michigan. On an average, there are about 40 to 50,000 active users in the system every day, and about 1.5 million unique logins into the system on a monthly basis. Next up is we have CHAMPS, which is the Community Health Automated Medicaid Processing System. CHAMPS is a web-based, rules-driven, real-time Medicaid information management system. It is a modular system comprised of the following units of functionality: provider enrollment, eligibility and enrollment, prior auth, claims and encounters, and contract management. CHAMPS serves approximately 2.5 million recipients and has approximately 92,000 application users, which include providers, health plans, and state of Michigan employees. Next is MyCEAS, Michigan Child Support Enforcement System. MyCEAS is the primary child support enforcement system used by the state of Michigan child support professionals. MyCEAS helps manage case intake, case management, establishment of paternity, establishment and maintenance of support orders, collection and distribution of payments, and enforcement of support orders. MyCEAS serves approximately 819,000 Michigan children and their families, and has approximately 2,200 application users, which include state of Michigan employees, contractors, friend of the court, and prosecuting attorneys' offices. The last one is Michigan MySACWIS, which is Michigan statewide automated child welfare information system. It is a case management tool used by both state and private child welfare agencies. To improve functionality, usability, and data sharing, MySACWIS is in the process of being modernized to the Comprehensive Child Welfare Information System, also referred to as CCWIS. I'll be talking about CCWIS in more detail later on in the presentation. MySACWIS serves approximately 58,000 children and has about 6,900 application users, which includes state of Michigan employees, private agencies, and our tribal partners. Here's a quick glance of the number of IT projects that were completed in FY24. We completed 48 projects in all, and the quarterly breakdowns on the screen: 19 in Q1, 10 in Q2, 5 in Q3, and 14 in quarter 4. Here's how the IT funding breakdown looks like. 27% of our budget is from the general fund, 71% is from federal funds, and we also receive 2% of the funding from other sources. Next, I would like to provide an update on the Comprehensive Child Welfare Information System. Our Children's Services Administration has 4 leading priorities, and they are ensuring equitable practices in child welfare, timely reunification and permanency, keep children safe with their families, and safety and well-being in care. The goal of CCWIS is to enable and support these key priorities. Here's a quick snapshot of CWIS. Sorry, I keep going back CCWIS and CWIS there. The general usage is CWIS, even though it's spelled CCWIS, so I'll try to stay to the CCWIS acronym for now. Here's a quick snapshot of a CCWIS roadmap and timeline. The project started in FY21, and we've been working on various aspects of the implementation since then. I will talk about, in the upcoming slides, I'll talk about what's been completed so far, what's in progress right now, and what's in store for the future. Between fiscal year 21 and 23, we built and implemented the Child Welfare Licensing Module, CWLM. We went live with the licensing module in October of 2022. The legacy licensing system involved a lot of manual work and required users to navigate between various tools and systems spread over multiple state agencies. The new licensing system addresses all of those bottlenecks. In addition to automating the manual processes, the department has realized the following benefits: reduced time to provider enrollment, improved efficiency by eliminating physical paperwork, improved data quality, and this is a key benefit of the new system, improved reporting and monitoring capabilities. Additionally, in FY23, we also built the foster care licensing portal. This portal was built to help prospective foster care parents. The portal simplifies the process of obtaining a foster care license. Between fiscal year 23 and 25, we concentrated on 3 major areas. First one was the pre-work and planning for the remaining 5 modules. We chose to be thorough and detailed in the pre-work because of the lessons learned from the implementation of our first module, the licensing module, and more importantly, based on the feedback we received from various states that had embarked on a CWIS modernization journey. In fact, our federal partners have been very impressed with our pre-planning work, that they've been recommending our approach to states that are about to begin their CWIS journey. The pre-work comprised of human-centered design and business process redesign. The goal of human-centered design is to put the end users in the middle of the implementation process. This helps ensure the system reflects the end user needs and usability requirements. Some of the activities that occurred as part of this were end user interviews to understand the needs, policy and practice reviews to eliminate discrepancies, and the project team also completed a lot of prototyping to validate user input and workflow requirements. In addition to the human design effort, the project team completed a detailed business process design. We optimized 100+ business workflows to eliminate unnecessary steps, improve resource utilization, efficiency, effectiveness, and performance. Overall, this effort resulted in 4,000 streamlined requirements, representing a detailed scope for the implementation effort. The biggest benefits, I would say, from the above pre-work were first building a common understanding amongst our stakeholders on what the scope is and what the vision of the new product is going to look like and so on. And building thorough requirements documentation is going to serve as a great foundation for the upcoming implementation. These two were real major lessons learned from our previous implementations. Additional areas of focus between FY23 and 25 were procurement activities and additional enhancements to the existing licensing system. We are in advanced stages of procurement, and a final selection and contract execution is expected to be completed before the end of this fiscal year. While the pre-work and the procurement of the future modules were happening, the team continued to enhance the CWLM licensing system that went live in October of 22. This was to fill in gaps in functionality that were identified later on, and also to address feedback received from the end users that have been using the system for a while now. A few examples of the enhancements are foster parent recruitment and retention planning, public-facing licensing search website, and rolling out updates to the licensing rules. Let's talk about what's next. Between FY 25 and 28, we plan to onboard the new vendor at the end of this fiscal year. And the implementation of the remaining modules is slated to be kicked off early fiscal year 26. There are 5 remaining modules that are listed on the screen that will be built over the next 2+ years. And we're expecting to release all 5 modules in fiscal year 28. All modules will be built, tested, and released in one go. That brings us to the end of the presentation. I want to thank you again for the opportunity to provide updates to the committee, and be happy to take questions.
Thank you. Representative Glanville?
Thank you, Chair, and thank you for being here today to walk us through some of this. I've had the opportunity to work with your staff, and they've been fantastic, so I appreciate that. And then just to give you a little bit of background, I have been on your side of implementing systems in education, so I kind of get like the process and what you're doing. So I have all the, yes, thank you. So with that in mind, I'm wondering if you can speak a little bit about how your team works. And what I'm wondering is, like, how do you prioritize projects? How often does that board meet to determine the workflow? Are there teams assigned to each application? Like, what does that look like in practice?
Okay, first from a right, who's involved in the process? I would say there are 3 distinct entities. One is DTMB, which is our technology partner. Then we also have the IT vendors, depending on the project. Some vendors have IT vendors, the others don't, and so on. And we also have the program areas, the business side. So we have the business, DTMB, and the vendors, depending on the project. And from an oversight standpoint, there's multiple levels of oversight. Even though I talked about the executive governance body, which is right at the top, there's different levels of oversight, starting at the program area level. So there's the local oversight body. And then at each administration level, there's about 6 of them. There's an oversight team at that administration level. And things bubble up, right? When there's a new IT idea or a project request, it starts at the lowest level, it bubbles up and goes through their oversight process, and then bubbles up to the IT executive governance board at the top. In terms of prioritization and trying to define right where to focus on, we've laid out what we call the IT road mapping and the strategy process. So the first step is, all these years we've been documenting the assets as in all the existing systems and new capabilities they would like to have. And each administration has a roadmap of assets and to-be state for the IT. And we try to bring all the roadmaps together and kind of collapse them, and then things bubble up at the enterprise level now. And there's only so much funding to go around, and depending on that, right? And then the other important aspect is, like I said earlier, we try to align our IT investments with the department's strategic goals. So that is a very key aspect. So all these projects and initiatives that align with the department's initiatives do bubble up to the top, and then based on the funding that's available, the board makes decisions. And that's kind of, it's a really high-level process, but I'm more than willing to send you documentation around how this works in the level of detail you're looking for.
Yeah, I might want to follow up on that, but if I may, with just a quick follow-up here. I guess what I'm asking at the end of the day is, do we have enough staff to have an agile IT system that can respond to user needs in a timely fashion? So I've been working in particular with the My Bridges and Bridges programs, and there are some really critical tweaks that need to be done, but I'm afraid with the process you just explained, which is a great process, but, how much time does that take? And if we can't be agile in our IT systems, then the work of all of us kind of grinds to a halt. So I guess from your point of view, what would you say about staffing?
Staffing, the easy answer is, right, we can always use more staffing. There's more work to be done compared to the staffing levels we have.
Any ballpark figure as to what would be your ideal?
I don't have the numbers. Like I said, we're talking about two different teams, one the department themselves and also our supporting partners, DTMB. We can follow up with the
Yeah.
numbers and write what that expectation would be, or what the optimum level would be.
Do you know how many openings you have?
I don't know about the DTMB openings. We do have openings on that front. Do you want to talk about an example, Sivas, on the staffing that you guys have been asking? Because instead of answering the overall question, maybe I want to give you a quick example of how the CCWS project's going, and then write some staffing requests that have been sitting out there.
Okay.
Go ahead, Kelly.
Yeah, certainly. So for our CCWIS team, we are the business side, so guiding our IT partners in how to make it the system functionally work for our staff, and our kids and families will benefit from that. So we are continually trying to add additional business staff. We have testing. We've gotten creative with different ways to do it, but certainly we do have staffing needs, and I would be happy to put forward a proposal of what the ideal situation would look like.
Thank you.
Thank you. Let me, I guess, follow up on some of that line of questioning. One, a lot of it is through DTMB, and I also serve on the General Government Committee and once chaired the General Government Budget, so familiar with a lot of the IT work that has been going on over the years and the relationship between the departments. We recently did a presentation in general government on agile software development, and kind of wanted to ask a question, kind of the same vein, of pulling back the curtain a little bit on how these decisions are being made and how these projects are moving forward. Because a lot of times what we see is typical is over budget, not on time as it relates to IT projects. And I'm curious of what you described of the decision-making and all the levels that are there and the people weighing in for a program, a major program that we're doing here with CSWIS, or CWIS as others call it, which is one of my new favorite acronyms in the DHHS budget. With that, do you have one person that is the program manager that you can hold accountable and say, this is on time, this is over budget, what have you, that they are held accountable? Is there some streamlining? Are there monthly reports that this is doing? I'm a little concerned when you say you're going to determine the contractor for the third module at the end of the fiscal year. It seems like when it comes to IT, we're doing things of a goal of the end of the fiscal year rather than having a goal of next month and breaking it down, or a quarter. It always seems fiscal year. And I guess there was a question there, and I'm still moving on. When you talk about technology, you have Moore's Law, right? Moore's Law is it's exponential. That's the growth of technology. Government is like this, nice and slow. This one's going fast, we're going slow. So how much have we lost in technology advancement of doing a project that starts in FY21 and now only goes to FY28? I mean, we'll be revising and adding new things even though it's not even completely built yet. So I guess going back to the original question, of the process that you do, is there agile development? Is there flexibility? Is there accountability that us as legislators can see the progress and that it's on budget, on time? You kind of skipped over the slide, but we spend 143.9 general fund just on DHHS for technology every year, or at least last fiscal year. DTMB's budget is $1 billion. This is a significant cost to taxpayers of our IT projects. And if they are delayed over budget, that's the taxpayers' money that's doing it. And I guess we have a perception of when you build a project, or you build a server, or you build a computer, it's done, and it operates. That you don't have this continuous money flowing into the project. So that was a little bit more than I anticipated saying, but it all kind of builds together of where are we on actually building systems that are timely and on budget, and that there's accountability so that taxpayers are not on the hook continuously for these.
That's right. So, right, I heard two questions there. The bigger question really is about the delays and the accountability aspects. I'm going to use CWIS, okay, since you started using CWIS. So CWIS project, yes, we do have a hierarchy, and it all, right, leads up to, on the technology side, from the delivery side, there is actually indeed one owner that we can hold accountable at the end of the day. And that person runs the technology team that's responsible for building the system. Again, it's not one team, it's one team, but behind the scenes, it's a combination of, right, State of Michigan full-time employees and our vendor partner. So it's one big team at the end of the day, but there is one person that owns that IT contract and is accountable and responsible for delivering the system. And I also want to talk about, yes, it sounds like it's a long time, but it's not that we haven't accomplished much. We have accomplished a lot of things over the years. It started in 21, and the approach we took with the project was we didn't ask for, right, one-time funding, as in, give me so much, and we're going to go build this and, right, get this all done in one shot. So we came first to ask for that first level of funding, which was focused on the licensing module. Our approach was going to be, right, since you use the agile terminology, we wanted to learn with this new system and the new approach. So we did spend that first year implementing the first module. We went live with that. We learned a lot of lessons, and we have factored all of those lessons learned into the, right, subsequent processes, and we have improved the process. And that is when we told ourselves, okay, we're going to take a step back. Right now, we're going to spend time to really plan the next 5 modules, do all the pre-work and be ready, because one of the biggest lessons learned was, right, you bring all the teams together and get going, that we would lose in time and money, because the focus, right, we want to be focused to start building and delivering stuff, but folks were not all on the same page. We were learning on the fly. We wanted to avoid that. And that's why we brought the human-centered design partner to go through and talk to the users and collect all of that information, then the business process redesign and so on. Now, right, and that took us almost a year. And even in the procurement process, we said we're going to take our time this time around, because the vendor ecosystems, like you said, has been shifting on the CWIS front. They have a new right, software model and an implementation model. We had to adapt ourselves to that. But at the same time, we also wanted to make sure that we were not constrained by a model that will not work for State of Michigan. In the past, if you've heard about transfer systems, right, what would happen typically is a vendor would partner with the state, build a system that suits their requirements. But then the next state comes on board, they want to modernize the same system. The vendor would say, hey, we've done this for so-and-so state. Do you want to take that one and modify it? Right? We've had experiences with transfer systems in the past, but we also learned that it just doesn't work well, because the workflows don't align, and then you end up spending more time modifying it, tweaking it. At the end, right, the project gets done, but folks are not happy at the end of the day. So we're trying to avoid that as well. So we're trying to balance, right, the approach with that customized approach State of Michigan is looking for. So that is why we have been very deliberate in every step of the way, and I think we have been very successful in finishing each item. Yes, at the end of the day, it's taken longer, because the vendor selection is not just selecting a vendor. There's a lot of paperwork that happens behind the scenes, be it security agreements with them, be it, right, other kinds of contract agreements. It's the paperwork typically. When I say fiscal year '25, I'm kind of hedging a little bit and trying to be practical. Yes, we are close to making that vendor selection, but we know when the attorneys get in and they go back and forth, it's going to take them easily several months to come to an agreement on that final contract, and that's why that the buffer in terms of saying, hey, end of fiscal year, we're confident in having one. I don't want to kind of ramble on. I want to see if I'm answering a question. Before I tackle one other question you asked about tech advancements and staying in sync with technology moving and we not being left behind.
Yeah, let's go after that one.
Okay, so I'm going to still stick with the CWIS example, right? Your question was, hey, you started building this a couple of years ago, and we know technology is moving so fast. And you started with this certain set of whatever, right? And you're building on it. Did the technology move ahead, and are we stuck with an older technology, right? By the time you finish, are you on a dated technology? So for this one, right, so we thought about this, and the approach we took was, in this case, we adopted a platform called Salesforce. Salesforce is a cloud-based online platform. The way the platform works is the platform continues to evolve, and we continue to build, and we always stay in sync with the advancements of the platform. So it's unlike, right, legacy technologies where you have a version of a software, you start building, you finish the system, and by then, right by the time you're halfway through or towards the end of the project, there's new versions of the software. Either you got to go back and try to upgrade, bring it back to, right, up to snuff here. We have avoided that problem by adopting this platform. So we kind of are constantly staying on top of the updates from the Salesforce platform, and we kind of move along with the advancements in the platform. And that's how we enable the shift or the right lag that happens typically with legacy software approaches. I'm hoping that answered your question on that.
Yeah, I guess from what I've heard, we're 2 years behind on CWIS. One, this is federally required, right? Or a court case that said we needed to change our system. So one, the amount of time that's taking, I wonder if we are become uncompliant with the federal standard because we're still doing MySOCWIS for some of these modules. So you got the pressure then from the feds to do this. We set out, I assume there was a set out budget for this program. Can we hold you to that budget, or because now at least 2 years delayed, do we have to spend that amount of money each year to keep this moving? Or can we say, no, that was the budget, and you need to be on the budget for the replacement for MySOCWIS?
So I'll ask Kelly to answer the first part about any impending federal deadlines, and then I'll come to the budget part.
And we've been working closely with the Children's Bureau at the federal level on our CCWIS system and sending them updates regularly. So I think that we are in alignment with what their expectations are because we've had that communication with them. They know that we have had those delays. As far as our federal lawsuit that we're under, there aren't any requirements. Right now, our current MySACWIS team is meeting the requirements for the data needed for that federal lawsuit. So I heard 2 federal questions in there, so I hope I addressed both of those.
And regarding the budget, yes, we do have a budget that's published, right, and documented. And like I said earlier, the approach we had taken was we didn't come ask for, right, this one-time budget at one time. So we thought we were going to learn every year as we continue to implement the system. And chances are it'll need revisions. And if we needed extra money, we would come back and ask you for that. But as of today, we have spent so much on the current implementation and the pre-planning work that we have done. And I think right now, for this fiscal year, we feel confident that we can get started and get close to the finish line. But if things change and we need more, I guess we'll revisit that and come provide an update next fiscal year or later. But for the next couple of fiscal years, we are all set in terms of funding.
Representative Green?
Thank you, Mr. Chair, and thank you for working on this monumental task of IT. My question in regards to the appropriations for this is, do you have a pie chart similar to the one that's on the screen in regards to what is a typical cost for a project. How much, let's say for the fun of it, a $10 million project to build a module, and I understand 10 million, I'm just using a roundabout number. How much of that goes to the vendor to build it? How much of that goes to DTMB to oversee the build? And how much of that goes to DHHS to oversee DTMB who oversees the build? That is one of my major questions in regards to the cost oversight. And as I've dug into this, I'm seeing that there's a small percentage that goes to the builder and a very large percentage that goes to the oversight and the oversight of the oversight, or the project managers inside of our stuff. So if you could get me, on average, you do over the last 5 projects, how much goes to the builder, how much goes to DTMB to oversee the builder, and how much goes to the department?
So I'll answer that in 2 parts. The first one regarding the pie chart or the breakdown of who's receiving what in terms of funding. We can provide that. It's case by case. There's no average in terms of what that split looks like. And in many cases, there's not even a vendor involved. It's all DTMB staff that take on that project and complete the project. So it is case by case. But for all the projects that we undertake, we are able to provide that breakdown if you're interested. So I can follow up, and maybe we can name a few projects and give that breakdown to you with the pie charts.
Inside of C-SWIS, does Deloitte
We
have?
definitely have the breakdown for that as well. For the spend till date, we have the breakdown between the 3 entities.
Okay.
DTMB, Deloitte, and DHHS. Yes, we can do that.
Okay, thank you.
And the only other clarification I'd like to provide is, it's not as clear-cut as, the builder does 100% of the work. In the case of technology implementation, the vendor comes in, yes, they do a lot of heavy lifting, but DTMB also has technical teams, and they play a role in the build in terms of integration, in terms of infrastructure services. So it's not as clear-cut as the builder is doing the entire build, and the other 2 entities are only providing oversight. And for the DHHS staff, they are working day in and day out along with the team in terms of providing directions, as business analysts and testers and things like that. So don't want to leave this room with the idea that the builder is doing all the work, the others are not, and they're only providing oversight. Everybody's sharing the workload. In some cases, the vendor does a lot more than the others, and it could be other way as well in other instances.
Representative Glanville.
Thank you. Quick clarification on Rep. Green. So what I hear you saying is it's not that there's oversight in this way, but it's different roles in the oversight. So if the vendor's building it, they're working with DTMB as the tech experts, more or less, of the state to make sure that it's meeting our system needs, what we already have in place with our enterprise systems, all those things. And then the department advises on, this works for us or no, it doesn't, in terms of customer feedback, user feedback, and things like that. So we need the input of the department, and we need the input of DTMB. They're coming at it, one as a user and one as a designer, right? Is that how it works?
That's correct.
Okay. And then the question I had was related to the chair's discussion about cost. And I just wanted to clarify, it sounds a little bit like, there's some thinking that, there's a set price for technology, and like a physical building, you build it, it's done. You can price out every piece, and it's quite clear. But with technology, not only, are you building it, but then you're constantly building it. Is there an ongoing cost? So you talked about Salesforce. So as Salesforce updates, would it be fair to say that you have somebody in DTMB, perhaps, who's on our side, running a sandbox and testing to make sure that their updates work with our system and things like that? So there's sort of an ongoing cost there. Like, you don't just take Salesforce and update it on Saturday and everybody's happy on Monday. Is that true? Or is it a plug and play with
So
no
you give
ongoing
me
cost?
I want to thank you for the question because, I love talking about this topic, and you're giving me a lot of leads into, many things I could highlight. The first one is, you said software, is it a one-time, a fixed fee, and can we deliver it? The challenge with software, unlike a physical building or building a bridges, it's not a physical construct, and there's no one blueprint that goes in and you build it, right? It's not that easy. Typically, when we say we are building software, we are building a product, and we go to another state and build this, you're building another product. So you're basically just think about a company that's trying to build a product for the first time and the amount of time and the effort and the complexity that's involved. That's what keeps repeating, right? Every time you build a custom software for anybody. So thanks for kind of helping me highlight that fact. And right, we also talked about oversight. I'm going to kind of touch on multiple points. We talked about agile, right? The concept of agile is, right, you know what you want to do, you have a right focused team, you continue to build, and at some point you run out of money, you run out of scope, whatever happens first, you stop there as long as you got some valuable stuff. But for complex projects like CWIS, right, we try to employ agile principles as much as possible. When it comes to contracting, we have steered away from open-ended contracts, or we just don't do it. We have never done it, and we don't do it. We always are trying to do fixed price contracts with the vendor. Because without that, we kind of lose the opportunity to hold the vendor accountable, and we just don't have any controls. So I wanted to say, it is a fixed fee. At the end of that fixed fee, or before the end of the fixed fee, we want to get a product done. Now, coming to the ongoing, right, updates and other things needed, it's not just Salesforce and keeping it up to date because the Salesforce ecosystem is kind of advancing. It's also the feedback we received from the end users, right? Users start using the system. Only then they realize, oh, you know what, I missed this thing. I didn't tell you about this earlier, so can we go back and fix it? Sometimes it's an easy fix, sometimes it's not. That's why we have to maintain an ongoing team. Typically, right, folks say keep the lights on, right, maintenance and operations. We very specifically call it maintenance and operations and enhancements, M and O and E. You got to have maintenance to keep the lights on, O to run the operations, and E, enhancements to kind of fill the gaps and address the feedback that we're receiving. So there is an ongoing commitment in terms of funding and the staffing. To be honest, truly, right, if you want to avoid these big bang or major modernization efforts, we got to get to a model of, right, not getting into a legacy pattern. If we can get to that no legacy mode, where you are constantly and consistently improving your product and keeping it right top notch, up to date forever, we would not have to get into the cycle of modernization where you have to find somebody, come build it again, and so on. And that is our ultimate goal. But I'm hoping we'll get there someday.
Me too.
Okay. Thank you. Yeah, I guess just to clarify and further question, we are running out of time here. Particularly with C-Swiss, I fully understand that there's maintenance here that you have to pay. But looking at the budget already, we've done 2 modules that cost $47 million just general fund, and I know that there's some matching dollars from the federal government. We've got, I think it's a 5-module or system, 9-module system, and from my understanding, there wasn't even put in place an actual budget for this, a end budget, a total budget for this. So we're kind of spending money as it goes. Maybe you guys recall a recent article about a startup company in China that created an AI system for $6 million, where we're spending $250 billion for AI systems or investments in AI systems. So that's another law with technology, is the cost is supposed to go down as efficiencies create. Certainly there's more new technology going, but there's supposed to be a reduction in cost, but for some reason, when we're talking federal government or state government or government in general, the cost just keeps going up, and we spend more and more, and we don't see those savings. So my concern here is we don't have a budget to abide by, or saying that this is how much we're going to spend. It's this system that is just kind of now perpetual with changing deadlines. So I'm curious of what that budget is and how we, as either the committee, the full approach committee, the legislature, get updates that this money is being spent and it's being accountable and transparent, and we are seeing results on the outcomes.
So on the question of, right, do we have a budget and a budget to abide by? Right now, we have one on paper. It's documented internally, and I think, right, I say I think because I don't have Amy Epke, who's our financial administration senior deputy here. But I can follow up and provide this. I have a copy with me, but I can follow up and provide the details on what's been spent so far and what's on hand as we speak, and the rationale behind not asking for any money this year or the next fiscal year. But to your point, right, can I give 100% guarantee that the money that we have is going to be enough? My hope is we will be able to provide you an updated version, maybe middle of next year when we get going. But right now, like I said, we have enough funding to take us through most of the bill. That is we're pretty confident about that. But I want to follow up and provide this document, and maybe if you have more questions.
And I do think that it's important to note that because we didn't have a vendor on, we were able to carry money over. We didn't spend in each of those years like we
Yeah.
anticipated because we didn't have that vendor. So some of that money from the original project ask is being carried over into future years. So that's why we're hopeful that we can very much stay within that, but we can provide some additional.
Great, thank you. Well, thank you for your presentation and coming before the committee. We appreciate you guys coming by. I have Representative Green moves to excuse absent members. No objection, the motion prevails by unanimous consent. There being no further business, the meeting is adjourned.